Thank you very much, Professor Asghar, Principal Allama Iqbal Medical College, sir, for taking time out of your busy schedule. Sir had a lecture in the Surgicon, and sir left there to join with us for this particular session. So thank you very much, sir. So we had a wonderful session yesterday and today as well. And we were blessed to have our teachers and legends. Professor Agyas had to leave for his lecture as well, but he and Professor Anwar both have stayed with us for 2 days, and we all have learned a lot from him. And the beauty of both the legends is that once they come, the whole team and the experts that they have trained, they automatically land in because they know that there is something special that they are going to see. So that's another aspect. I'm really grateful for Professor Israr from coming from Mayo Hospital, from Dr. Ayub coming from Fatma Jinnah Hospital. Then the whole team of Lahore General Hospital is here, and they are here with us for last 2 days. And you all have seen how have they interacted and made our sessions very meaningful. So we also have Professor Mughis from Faisalabad and Dr. Najam from Gujranwala. So that really gives me an immense pleasure that so many of my friends have come to support and make this a success. So thank you very much, sir. It is always a pleasure to be with our teachers and learn from them. And it's such an inspiration for you once you see that these people are still learning, and every new procedure they just are mastering that, and they have shown us that if you have perseverance and if you have will, then sky is the limit. It's so amazing to see Professor Anwar and Professor Gyas that they have taken the level of interventions to an international standard. Now we can proudly claim that any procedure being done in any part of the world, may it be a developed country, is being performed in Lahore General Hospital, in Sheikh Zayed Hospital. So it's a great honor for us because it gives us immense opportunity to learn from them, and it gives us motivation that we must follow their footsteps and we must continue the tradition that they have developed over the last few decades. Thank you very much.
I would now like to request Professor Anwar A for a little thank you note.
Thank you very much, Professor Shahid Sarwar and Professor Naqi Saab. It's such a pleasure to be with this audience of very enthusiastic group who have stayed stuck together for last 2 days and showing all the interest. And I must say that the quality of the cases who were selected and performed here are no less than anywhere in the world. And all those teachers and professors, Professor Gyas, have tackled with very difficult cases and done it very methodically and keeping in view all the protocols and the guidelines which are given all over the world. So we have learned a lot, and I think this department has come up for the last 3 years to a standard which can match anywhere in the world. And I will encourage Professor Shahid Sarwar to continue to endeavor with further whatever are needs for the department. I will request Professor Naqvi also to kind of support him to bring it to a level where all the learners who are working with him, they must feel confident that they can go anywhere in the world and do these procedures. Thank you very much.
Thank you so much, Professor Anwar. Now I would request Professor Syed Asghar Naqi to please grace us on the stage.
Thank you very much, Professor Anwar A. Professor Shahid Sarwar, I must thank you for arranging this wonderful workshop. I have a personal incidence with Professor Anwar Saab. I was surgical registrar way back about 28-30 years ago, and I went with my mother-in-law to consult with Professor. She had pain in the epigastrium and she had ill-defined mass. And so I took a history and palpated, and he told me to get a CA125. And I got the CA125, it was 512. And he told me that you should go to a gynecologist, and as this is an ovarian carcinoma. So I at that time was working in Gangaram Hospital, and I went to 3 famous gynecologists of Lahore because the CT did not show anything and the ultrasound was unable to pick anything. And they told me, no, it's not an ovarian carcinoma. So I went back to Khasab, and Khasab did a laparoscopic biopsy himself of the peritoneum. And the disease has already spread to the peritoneum. And he was the person who diagnosed an ovarian carcinoma with the person who had an ill-defined mass in the epigastrium. So I've been a fan since, sir, and it's an honor and pleasure that you are here and you're gracing this occasion. You are teaching these so many enthusiastic gastroenterologists. Surgeons and gastroenterologists, they work side by side, and no surgeon worth his salt can work without a proper gastroenterology team with him. I consider all invasions as surgery. And as my teachers used to say, कि surgery करके सीखने से बेहतर है कि surgery सीख के की जाए. And as Bill Roth had said about now 180 years ago, that the outcome of the surgery tells you about the success of surgery. So this stands true for all kind of invasions. And you people are, I think, doing many more invasions than surgeons do nowadays. Most of the surgeries that upper GI surgeons used to do, even HPV surgeons used to do, are now obsolete because of few people. And you are going to make most of us looking for more work. So, sir, thank you very much for coming and teaching us. I can see Dr. Israr, Professor R, Ghiyas Sahab, and many. Kashif is also here. So, thank you very much for coming and helping us run this workshop in a very successful manner. So Shahid Sahab is working hard to get all these gadgetry things and have this department as a properly stocked gastroenterology department where all kind of procedures can be done. And we are trying to make it happen. With your blessing, inshallah, we'll be able to do it. Thank you very much.